All right, welcome. This is the Cognitive Behavioral Therapy Insomnia Group online format, and we recorded this so that if you're attending in person and you're not able to make a session or two, you still have access to what we go over so you don't get behind. I'm Juanita Hill. I'm a licensed clinical social worker, and this is...
And I'm Seth Rose, and I'm a cognitive performance specialist.
And we're going to go over with you the gold standard for treating insomnia sleep problems using cognitive behavioral therapy for insomnia, the group format. It's going to be a 6-session protocol, and today's session 1. So we like to get an idea of some of people's beliefs regarding sleep. And so this is a nice little check-in in regards to your own beliefs regarding sleep. So just take a moment and read over some of these questions and see what you believe to be true for each of these sections, and we'll briefly go over them with you. So just thinking about number 1, which areas might lead to sleep problems? Number 2, everyone needs 8 hours of sleep in order to not feel exhausted. Number 3, the best thing that you can do if you can't fall asleep after 15 minutes is to stay in bed no matter how long it takes. 4, people typically sleep the same throughout their entire life. And thinking about the ways in which some specific things might improve your sleep on number 5. And then number 6, just thinking of one way you think someone could improve their sleep, maybe something you've tried that was successful or maybe not so helpful. And then thinking in general, insomnia. Is it a rare sleep problem or not so much? Okay, so is the next slide going over all the answers? I can't remember.
Yeah, just cover them here.
Okay, so number 1, which of the problems might lead to sleep problems? So if you look at that, actually, all of them can impact sleep, and we're going to get to why that is. Some of those are more obvious than others, like, for example, having a caffeinated drink before you go to bed. Obviously, that's going to make it harder to fall asleep. But daytime napping, you might be thinking, what's the big deal about that? We're going to get to why it's important to try to restrict napping if you are having significant problems falling asleep, staying asleep at night. Number 2, everyone needs 8 hours of sleep in order to not feel exhausted. That's what we're told. We grow up really emphasizing 8 hours, and that's not necessarily true, especially as you get older, you tend to need less sleep. And so we'll get into that more throughout the protocol. Number 3, the best thing to do if you can't fall asleep after 15 minutes is to stay in bed no matter how long it takes. And actually, we hear this a lot where people are like, oh, I got to be in the bed so that I'll fall asleep. I'm not sleeping so well. That's actually not true. It's important that if you're not able to sleep and you're worrying in bed, that you just get out of the bed. And there's a lot of reasons for that, and we're going to cover that in this protocol. Number 4, people typically sleep the same throughout their life. This goes back to the earlier one. Everyone needs 8 hours of sleep in order to not feel exhausted. That changes as you get older. As you get older, you tend to need less sleep, and so that will change throughout your lifetime. Just like when you're a kid, you need more sleep. Number 5, which of the following may help to improve sleep? So drinking alcohol, although it may help you to fall asleep, it definitely impacts the quality of your sleep. And so there's lots of reasons why we want to steer clear of drinking a lot of alcohol before bed. Using sleeping pills regularly definitely is not an answer long term, and so we'll go over that. Establishing a regular waking time is extremely important, especially with this protocol. And we'll be talking a little bit about that in this protocol, why that's important. But that definitely can improve your sleep if you have the same wake time. And in regards to discussing family problems in bed, definitely a no-no. That's going to be very activating for you. And at nighttime, it's really important that you establish ways to relax. And if you're talking about things that are problematic, then that's not going to help you relax at all and prepare for bed. And thinking of what you could do to improve your sleep, there's tons of different things. Since this is not interactive right here, we won't be able to hear what your thoughts are, but I'm sure you've seen lots of different ideas online, in person, and so some of those things we'll cover in this protocol, and we'll also be able to address any myths or things that actually are not super helpful. In regards to insomnia, is a rare sleep problem. That's actually not true at all. It's actually very prevalent throughout the US and the world. A lot of people have sleep problems at some point in their life. And so this protocol is really an excellent way to gain lots of tools so that if you do find yourself in a bout of insomnia, you know what you can do to get back on track. Okay, so what is CBT-I? This is an evidence-based treatment, meaning there's lots of research on its effectiveness. It is what we considered as the gold standard. So the the number one thing that people use to improve their sleep. It will address issues with not being able to fall asleep or stay asleep. It's very behavioral oriented, meaning that we're going to ask you to change your behavior, make some shifts in regards to what you're doing to improve your sleep. It also addresses your beliefs regarding your sleep. It gives a lot of education and information about sleep behaviors and the biological and psychological processes that can impact your sleep. It is very structured, so each week we're going to have a specific topic. We're going to give you a little bit more information, and we're going to ask you to implement those things that we're going to talk about each week to continue to improve your sleep. It will really be important that whatever we're going over that week that you follow through in between session because that's where you're going to be able to see the change. It is not unusual for your sleep to get a little bit worse before it gets better, and that will make sense as we explain what the protocol is. But it does tend to get better if you stick to the protocol and you follow through each week.
All right, so speaking about structure, here's an agenda of what we'll be covering during this protocol for the next 6 weeks. So today with week one, you'll get a brief overview and some of the initial sleep hygiene guidelines that you'll follow throughout the 6 weeks. And we'll end with some goal setting for yourself. Following week two, we'll talk about some of the behavioral components that maintain insomnia behaviors. And then weeks 3 through 5 will be some of the techniques to cover some of those things that Juanita was talking about when it comes to relaxation, calming yourself down, both physically and mentally, and then ending with some lapse and relapse prevention for week 6. And you'll be getting handouts each week, whether you're attending in person or if you can't make it, we'll be sending those out for each of those weeks. So talking about some of this modern day sleep habits across the United States, as Juanita mentioned during the quiz, sleep problems and even insomnia and sleep deprivation is pretty common. So there's quite a bit of information here on the screen on this slide, but let's just cover a couple of them that stand out. So looking at that first bullet point, nearly 75% of all Americans say that poor or insufficient sleep has impacted their daily activities at least once in the past week. Another one that stands out is about 50% say that they have trouble falling asleep. Nearly half of all Americans say that they've driven while feeling drowsy at least once in the past year. So we see that sleep deprivation and feelings of tiredness or not getting enough or quality sleep can impact daily activities such as driving, which can be dangerous. The other one that stands out is the third bullet point from the end there. More than half of Americans use some sort of electronic device within an hour of going to bed, which we'll talk about during the sleep hygiene guidelines, how that type of electronic device before bed can be very arousal producing and cause some sleep disruptions. And then lastly, nearly a third of Americans say that they don't get a good night's sleep on a regular basis. So we see that the good night's sleep ebb and flow, and so do the bad night's sleep. All this to say that sleep issues is a common issue across the United States. Um, and moving on to even more specific when it comes to sleep in the military, we see some of those issues being reported in service members and military personnel. For example, a recent study in 2018 found that military personnel deployed reported an average of 6.5 hours of sleep per night, with about 75% reporting poor sleep quality. And we'll talk about the quantity of sleep, and as Juanita said, it does decrease as you get older, but we'll be toying around with sleep need and how much sleep that you should be getting on a weekly basis during this protocol. Another study in 2016 found that service members in training and on deployment typically got 6 to 7 hours sleep per night, with about half. So we see some common themes there. Now, when we think about overall, a lot of these studies are suggesting disrupted sleep patterns, poor sleep quality due to a variety of factors. We know that there's higher levels of stress in certain cases, higher op tempo, operational demands. Maybe there's some shift work or things that you have to do off hours into the weekend, or even if you are deployed. And we do see how that disrupts both physical and mental health in and out of work settings. So hopefully, you're here because you want to prioritize your sleep and establish some healthy sleeping behaviors. So that way we can help increase some better outcomes when it comes to our physical and mental well-being.
So what is insomnia? So we use the DSM to diagnose different things, including insomnia. And the way it is defined is by your self-reported symptoms. So you don't need to go to a sleep study to get a diagnosis of insomnia. If you do have a lot of sleep problems, you could also get a sleep study to rule out other things, like, for example, sleep apnea. But for insomnia, you don't need a sleep study. As we talked about before, it is really prevalent. It does come up quite a bit. Of the people who do have insomnia, 10% of those people end up having long-term insomnia, meaning that typically whatever brought on the insomnia, even when that stressor goes away, that might have impacted the beginning of insomnia. A lot of people, because of some behaviors they start to engage in, will continue to have insomnia even though the initial problem is resolved. And so a lot of the strategies that you'll get in this protocol will really help you to be able to make sure that that doesn't happen for you, and that you're able to improve your sleep and no longer meet criteria for insomnia. So the actual symptoms of insomnia is the person has to have a complaint of sleep quantity or quality that's associated either with problems falling asleep, staying asleep, or early morning awakening. And the problem with the sleep has to cause distress or some sort of problem either at work with other people, maybe your mood, but it's got to cause some sort of problem. And the sleep problems have to occur at least 3 nights each week, and it's got to be going on for at least 3 months. The sleep problem has to persist even if you have an opportunity to sleep. And then, of course, you want to make sure that the sleep problem is not really better explained by some other issue, whether it be a medical issue or some sort of behavioral health issue. So this is something, as you can see, as I go through the criteria, it's not too hard to meet the threshold for clinical insomnia, and that's what it looks like. So just the 3 times a week, at least 3 months, even though you had adequate opportunity to sleep, and causing some sort of distress or impacting your life in some way. Of course, there are other sleep disorders, and these are ones that you do need to go for a sleep study for. So, for example, sleep apnea, that's something a lot of people have. One way you can tell that you might have insomnia is if you snore. That's sort of a telltale sign. So, if you do snore, I would talk to your medical provider about getting a referral to the sleep clinic so that you can get a sleep study to find out if you do have sleep apnea, because that's basically meaning you're not getting enough oxygen at night. So even if you are getting enough sleep, you're still going to feel really tired because during the night you're not getting enough oxygen. So it's really important to address that. If you are somebody who snores, there are other symptoms of that too, but that's the one that's really highlighted. There are some other ones, for example, restless leg syndrome. So having the urge to move your legs a lot, or periodic limb movement disorder. um, this is another one where you do have to have a sleep study to get diagnosed. But these are lots of movements that you make throughout the night. So if these are things that you're noticing in your limbs and the need to move, these might be other reasons to get a sleep study, but these are not things that we will address in the CBT-I protocol. So, how does sleep insomnia start? Because as I told you earlier, some people will get insomnia usually associated with some sort of stressor. And then because of some behaviors they start to engage in, really trying to improve the sleep, but really are not good for long term for your sleep, it can develop into long-term insomnia. This goes into what are the factors. And so there are three things that we're going to look at today. We're going to look at the factors that make you a person that may be vulnerable to starting to have insomnia. We're going to talk about some of the external factors that might initially cause insomnia and those behaviors that could maintain the insomnia and make it so that you're one of those people who have chronic insomnia that lasts for a very long time.
Right. So let's take a look at these various factors. So vulnerabilities to insomnia, some of the factors listed here, such as increasing muscle tension, maybe you have some worrying or different types of unproductive thinking styles. Poor sleep habits in general can make you vulnerable to insomnia. The worrisome thinking styles leading to worry. And then, like we had mentioned earlier, aging can definitely be a factor here. Things that might initially cause insomnia, we know that stress and various stressors throughout, uh, you know, the recent past can cause initial onset of insomnia, even if they are acute stressors, meaning smaller day-to-day stressors that maybe are building up. We also see things like a personal loss in your life, like a death, could potentially cause some higher stress in your life that might cause some of those accompanying unproductive or worrying thoughts. Various family conflicts might cause insomnia, work problems, maybe personal or family medical problems. As I mentioned before, chronic low stress levels. So maybe it's not necessarily uh, in the moment stressor, but day-to-day stressor throughout a various period of time. And also changes to your schedule might cause that as well, depending on if you're switching from like a regular morning routine to now you have to do some evenings, or working different days. And then things that might maintain insomnia, going back to those poor sleep habits. That's kind of, we'll talk about how those can kind of lead to some of those worrying thoughts, and then kind of puts us right back into the poor sleep habits. So it's kind of cyclical in nature. Misinformation about sleep. I feel like now there's a lot of, uh, you know, uh, things out on the internet that, when it comes to sleep and health and well-being, that you might be trying because everybody else is doing it, or, particular personalities online are doing different types of things. But remember, this CBT-I is gold standard clinical treatment for disruptive sleep. So keep that in mind when looking up various things online. And please let us know if you have any questions regarding some of that stuff. Regular use of sleep medication or sleeping pills. We won't be talking too much about medication, but do know that it's not really advised to stay on those sleeping pills for long periods of time. And making behavioral shifts is better in our in this protocol. So you certainly ask us about it, but know that regular use of it might cause some prolonged insomnia behaviors. Other medication for other types of health problems might impact that and maintain insomnia. Irregular sleep schedules, anxious thoughts, staying in bed for a long period of time, and we'll talk about why that is important. And then also daytime napping, which we'll talk about during this protocol, are kind of our rules on napping. And there might be other things that might be vulnerabilities or initial causes or factors that maintain insomnia that aren't listed here. So do know that you might be experiencing something that's not necessarily listed here, and that's okay.
Okay. So as a recap, the model of insomnia is that we've got a couple things that can create this, including, personal characteristics. If you're a worrier, if you're somebody who likes to have lots of control, know what the plan is, being able to take charge, that can make you more vulnerable to insomnia, as life has many things that pop up that are out of our control, and there can be lots of things that you could worry about. Also, life events. There can be a variety of life events, including positive life events. If you're getting married, that's exciting. If you've got a really cool job that's coming up, that's exciting too. But those are big life events and changes, and that can also set you up for some insomnia. And so these personality characteristics and external life events together can have a shift in your ability to fall asleep and stay asleep. And then once that happens, sometimes some of the behaviors that we engage in can maintain some of those things. So, for example, maybe trying to sleep in because you're thinking, well, I wasn't able to sleep all night, so I'm just going to sleep in later. That actually it will prolong the insomnia. We're going to get into why that is. Maybe you just can't fall asleep, so you start drinking some alcohol before bed in hopes that that will help you to pass out. And that will, but it certainly will not be a good quality sleep, and that's going to extend the insomnia problems. And so there's a lot of different things that people can start doing that can actually maintain the insomnia, even though that really the goal is to make it go away. And so we are excited to give you some specific tools that are evidence-based that will actually work if you consistently use them.
Yeah, and when we shift over to the right side of this slide, talking about maintaining factors, starting with that first arrow on top. So those with insomnia are usually more prone to higher levels of arousal. So they're always on, both mentally and physically. And that, arousal then might trigger other things. You might be more prone to, increasing levels of arousal. Maybe you can't switch it off, which then would lead to potential worrisome thoughts of, not being able to shut it off. There might be some ruminations that are associated with some of that, which then causes some of the opposite effects of, relaxing behaviors that we see, like muscle tension or general restlessness during the night. And then this constant arousal, higher levels of arousal, will lead to, potentially you thinking about the sleep that maybe you're not going to be getting because you're restless and, higher stress levels and tossing and turning potentially. So this is where people start to estimate, like, oh, I only have this much more time left to sleep. I need to, stop thinking so much. And then they start to ruminate even more. Um, Most of the time we see with people who have insomnia is that they are underestimating the amount that they are actually sleeping.
Mhm.
So, you might be saying, oh, I only got 2 hours of sleep last night. When we learn a little bit more about the stages of sleep and those factors, you might be surprised of how much sleep you're actually getting. But then that leads to overall levels of fatigue, lower levels of mood. Um, Maybe you are perceiving that you're not performing well in your job or at home, which then now you're associating all of those negative things with um, worrying about trying to get better sleep. Um, and um, then that's where we see maladaptive sleep habits beginning to form or continuing to maintain this cycle.
Okay, so we've got all the different factors that can contribute to insomnia being created, the predisposing factors that we talked about earlier, the personality, the external events, life events. Then you've got the acute insomnia where you're not able to fall asleep. Maybe you're not able to stay asleep. Then you start to engage in some behaviors that are actually not very good long term. And so then you've got the symptoms where you're not able to sleep for at least 3 days a week. Time passes, and it's been at least 3 months, and now you've got the early insomnia. And then over time, with all those perpetuating factors that we talked about, it continues on for more than 3 months, and now you've got chronic insomnia. And so this program is going to help you to be able to make sure that you're not in behaving in those behaviors that will continue the insomnia, and that you start shifting some of those behaviors to help you to be able to successfully be able to fall asleep and stay asleep, and what to do if you cannot sleep on one particular night. So this is a really good program, and I'm super excited that you guys are doing this. And so we'll continue to move on with the next slide. And this is just kind of a recap that it all impacts each other, right? So as Steph was saying, people who tend to get insomnia, they are usually kind of on more. And so there's a higher level of arousal. And then since you're not able to sleep, just noticing the thoughts that you might be having about not being able to fall asleep, and how that can perpetuate the on feeling and kind of not being able to relax. And then, of course, being tired. And then being tired can make you irritable, not being able to be, at your 100% because you are feeling exhausted, and then kind of engaging in habits, trying to get a good night's sleep that might actually or could be counterproductive, which keeps the cycle going. And so the CBT-I is really to break that. So what does make you sleep? Because we talked about all the things that make it hard for you to sleep. So what are the things that actually do help you to sleep? So we've got the sleep drive. So that is basically how long has it been since the last time that you slept? That's why it's really important that if you're having problems with sleeping at night, that you don't engage in a lot of napping, because if you take a nap, then your sleep drive will be weaker because it'll be a shorter amount of period since the last time that you slept. And so it's important that we want to keep your sleep drive very strong by not engaging in naps if you're having insomnia. The other component is your sleep clock, so the circadian rhythm. That is, how much sunlight exposure do you get during the day? And it's really important that if you have insomnia, that you get exposure to the sun in the morning early. If you want to talk a little bit about that, Seth.
Yeah, so we know that the light is going to impact our circadian rhythm. So if you are needing to kind of like reset, you can start with morning sunlight. And then also to help set you up for nighttime and a better night's sleep, that morning sunlight has also been shown to kind of dump um, excess levels of cortisol, which is a stress hormone. So that way you have a better chance of having low levels of cortisol closer to the night when you're actually trying to get to sleep.
And then we've also got our sleep disruptor. So maybe you have little ones at home, and maybe they, get up really early, or maybe there's a baby that is up and crying and you have to get up, or maybe you have a dog or a puppy, or maybe there could be other reasons that in the night it will disrupt your sleep. And so just thinking about how all these different factors can really impact your ability to get a good night's sleep. So where does that leave us? And so this is where we're gonna start is the sleep hygiene guidelines. So what we're gonna do is we're gonna go over these, and then every week we're going to revisit them because it's really important that this is our base, and then we're gonna be asking you to do additional things on top of your base. But as the base, it's gonna be really important that you try to adhere to this so that when we add on the other behavioral strategies, it will be more effective. So just kind of going over our base for the sleep hygiene, we really want to make sure that you're avoiding caffeine 6 to 8 hours before bed. So if you like coffee or your energy drinks, that's fine, but just making sure that whatever your bedtime is, that you go back at least 8 hours and you really try not to have any caffeine during that time so that your body can start to wind down and it's not feeling amped up from the caffeine. Additionally, in regards to nicotine, if possible, trying to avoid any nicotine 2 hours before bed is really important because that will also kind of keep you up. It's got some caffeine in it as well, and so it's really important to try to not use any nicotine a couple hours before bed. As it comes to alcohol, some people like to have some maybe a drink with their dinner or whatnot. That's fine, but if at all possible, try not to drink 2 hours before bed because the alcohol can impact your ability to go through the different levels of sleep. And so we will get through that. I think that's the next session when we go over the stages of sleep. But alcohol negatively impacts your ability to go through all the stages of sleep that you need to get really good restorative sleep. If you are using sleeping pills, then we want to make sure that it's a temporary thing. It's not something that you're going to lean on for your whole life because that's not a good strategy. We want to make sure that you're engaging in more effective strategies that are behavioral oriented. And so the sleeping pills, if that's something that you are using in conjunction with your medical provider, it is a temporary thing. Let's see here. When it comes to exercise, trying not to have a good workout a couple hours before bed. You want to do that earlier so that your body does have enough time to wind down and start to relax. A really great tip, and Seth, if you want to speak to this a little bit more, is about the hot bath, hot shower.
Yeah, so just one last point on the exercise. So moderate exercise is okay. It's the real hard, vigorous ones that will kind of impact and keep you wound up and those arousal levels higher. Um, uh, so if you're going to do like light exercise, that'll sometimes help you get relaxed before bed. Um,
Yeah,
the
like yoga or stretching or a nice walk, but nothing like I'm running or lifting heavy weights or doing
right,
a really hard workout.
right. Yeah, so the hot shower one is a great tip to do as a way to unwind. So when we think about getting closer to bedtime, our kind of body has like a temperature sort of shift, and we like to be a little bit cooler in the night. And so a hot shower can help us kickstart that drop in temperature. So you get in the hot shower, and then when you get out, your body gets really cool in the bathroom, and that can kind of kickstart that drop of temperature before you get into bed. But making sure that you do it like 1 to 2 hours prior to bedtime, because sometimes the hot shower and then getting right in bed, you're not leaving that time for it to start to drop down.
And then, like we talked about earlier, we want your sleep drive to be very strong. And so, although napping can be helpful if you don't have insomnia for various reasons, if it's very short, it's not something that we want to do if you have insomnia. So, trying not to nap during the day if you're having insomnia problems. And then, of course, your environment is really important. So making sure that wherever you're sleeping, your bedroom is nice and quiet. It's cooler. It's a cooler temperature. It's dark. If you want like a light white noise in the background, that's fine. But we really want it to be a place that feels relaxing so that you can feel like you can fall asleep. So making sure it's comfortable, you have pillows that work for you, the bed is comfortable, but just really making the environment one in which your body can relax. We're also going to encourage you to avoid eating within 2 hours of bedtime. If you feel like you do need a snack, then keep it small, something not super sugary. So maybe something like we got these tips from the nutritionist that we at work, LT. So she gave us these tips to maybe low fat Greek yogurt, cottage cheese, nuts. Um, she mentioned sugar tart cherry juice is also good. So those are some things that are fine, but nothing big, because we want you to be able to fall asleep. And if you have a big meal, that can really interfere with all the body moving that around. So thinking about sleep, um, good sleep can help you in so many ways, and so it's important to think about why are you doing this? Of course, you don't want to feel tired, but what are some other things that you're going to get out of being able to consistently sleep really well and get that good restorative sleep? So just taking a moment and thinking about this group is going to involve some commitment on your level, because most of the things are really going to be about implementing the strategies that we talk about in between session. And so um, thinking about what is the end state for you? What are you hoping to achieve by improving your sleep?
And then lastly, we encourage you to kind of look at your goals when it comes to this protocol in these 6 weeks that you're here for. So like, what are you wanting to gain, with your improvement in sleep? Why are you here? Why are you willing to put in the effort? And kind of talking about some of those personal reasons to help with that commitment level. So we have sent you a goal setting kind of form that goes through some various prompts for you to think about. And so we encourage you just to spend some time right now to go through those. Some of those questions involve like main goals. Some of them involve identifying obstacles that might be in your way. So maybe some of those sleep disruptors, maybe some work related or family related issues, and how you're going to navigate those during these 6 weeks. Maybe that includes getting your family on board to hold you accountable to some of those sleep guidelines, um, and really identifying like on a scale, how committed are you to this, so that way you can put in um, that personal accountability as well, not just the accountability from others. Um, so your personal commitment to the protocol, that goal setting form, super important to fill out and take some time with. And then you're also going to have a copy of the sleep guidelines, the sleep hygiene guidelines. So that way we can either give you some in person the next time we see you, or you can print those out and have those readily available to kind of follow. And then you will also start to track your night's sleep across the week. So we have paper pen sleep logs that you can fill out, and you'll have those filled out prior to the next time that we meet. Or if you have some sort of wearable that tracks your sleep, you can use that to kind of help you fill out that log, because the log does have some additional insights and questions. But it's really important just to track your sleep with those logs or some type of wearable, because we'll be using that information to adjust your time in bed based off of your sleep efficiency score. And we'll cover that the next time that we meet. But yeah, other than that, Juanita, is there anything else before we wrap
No,
up?
I think that's it. But just it is really important that you do log the sleep, like Seth said, because we will use that to create your new sleep schedule. And then each week we're going to be giving you questionnaires to determine whether or not we need to make some more shifts. And so this kind of goes hand in hand with your sleep might feel a little bit worse before it gets better, because we'll be making some changes. So please do fill out the sleep logs or have some way to log it, so that next week we can take a look at it and determine where we're going to get started and what changes we need to make with your sleep schedule. I
Mhm.
think that's it.
Okay, we'll see you next
Okay.
week.
Thank you. Bye.